guys, it's Khaki. Today I would like to talk about something that's a little on the serious side, but something I think that all of us in the bariatric community, whether pre-op or post-op, need to educate ourselves about. It's also something that's been requested quite a bit. Transfer addiction following bariatric surgery. Basically, transfer addiction is when you use a substance or a behavior to fill the void that you can no longer fill with disordered eating. And I think most of us would agree that those of us in the bariatric surgery community used food in a disordered way, whether it was to self soothe, whether it was out of anxiety, out of celebration, whatever it was. Very few of us got to the point of needing bariatric surgery because we ate to nourish our bodies. Transfer addiction is shockingly common. One statistic said up to 30% of post-op patients in the bariatric surgery community experience some kind of transfer addiction. The most common is alcohol, also shopping, sexual behaviors, internet addiction. There can be a lot of things that we use. Exercise is another one that I see frequently. I always get a little worried when it feels good to be active when you haven't been able to in a long time, but when that behavior goes to a unhealthy level, that would be a transfer addiction. The thing that I think a lot of people don't realize is that with alcohol, for example, you don't have to have a history of drinking to excess to end up with an addiction to alcohol after bariatric surgery. One study said that 18.4 up to 40.6% of people who identified themselves as having problem drinking after bariatric surgery never had problems with alcohol prior to surgery. So that's a third, basically, of people who realize they have an issue but never had one before surgery. So, why is that? Some of the things that can put you at risk of having a transfer addiction that I think we all need to assess in ourselves is a family or personal history of addiction. As I said, it can sneak up on you. It's not always something that you've maybe pushed a little to the limit previously, but that would certainly put you at risk. And especially if it is a family history, that does tend to run in families. A history of trauma, of personal trauma. That doesn't have to be sexual trauma or childhood abuse, but things that you identify as traumatic in your past. A history of an eating disorder, big one. That is a big one. Another is a history of depression or anxiety. And honestly, I think that most of us in the bariatric community would identify as having this issue. A history of chronic pain. Once you have bariatric surgery, your pain management options are limited. Some people find that they turn to a substance or to a behavior to cope with that. Avoidance of emotions, big one. It's a lot easier to self soothe with a behavior or a food or a substance after bariatric surgery than it is to deal with those things and work them out. Lack of adequate support. I think that's a big one. A lot of folks who are obese do tend to self isolate or feel isolated, whether it's reality or not. A history of self sabotage. I hear this from so many people. I don't know why I do this to myself. I was doing so good and I screwed it all up. Think of those things. Do any of those fit you? If so, just be aware. This is one of the main reasons that all programs that I'm aware of in the United States require a psychiatric evaluation prior, well, let me say, all programs that accept insurance require a psychiatric evaluation prior to approval of surgery. I think that a lot of people get upset about that. They think that the examiner is trying to stop them from their surgery, put up a roadblock to their surgery. The reality is, I think they're trying to identify people who potentially have problems and maybe point them towards the direction of working that out before it actually happens. So when you have that psychological evaluation, don't think of that psychological examiner as the bad guy. They're trying to help you. So, what can you do to prevent transfer addiction? One of the biggest things that most studies show to prevent transfer addiction is follow up. Whether that's keeping regular follow ups with your bariatric team, going to support groups, staying close to your bariatric friends, keep those lines of communication open. The other thing is when you start to do something in the past, which you would have eaten, if it is get on Amazon and shop, if it is drink alcohol, remember that acronym HALT. Am I hungry, angry, lonely, or tired? Why am I doing this? And stop and analyze that behavior before you do it. The other thing, educate yourself. Do some research about transfer addiction. Look for those behaviors that may put you at risk. Stay close to your support. And the big thing, ask for help. If you see those behaviors beginning to come out, ask for help. Don't be ashamed. We all need help sometimes. We needed help before we had bariatric surgery. We asked for it. We can do it again. A while ago, somebody asked in a video about my decision to drink alcohol after surgery because a lot of programs say it's a no go forever. I think that is in order to protect from transfer addiction. There are things that I have done. I did make the decision to occasionally drink alcohol. The things that I have done to guard against transfer addiction, I don't keep alcohol in my house. That will stop me from coming home, having a stressful day, and looking up in the cabinet and getting out a bottle of wine. I could still do that, but I'd have to go to the liquor store or the grocery store to get it. I think on a very few occasions, I've had two drinks. Most of the time, I only have, well, all the time, I only have alcohol when I go out to a nice dinner with friends. I typically have one cocktail or one really nice glass of wine. That's something else that I've done. I don't drink the cheap stuff. I think that when you're paying $20 for a cocktail or a really nice glass of wine, it kind of limits your behavior a little bit as well. I'm not drinking the $2 chuck when I go out. Those are just some of the things that I have done. And when I order alcohol, I do stop and think, do I really want this? If I do, I have it. But I only have it under certain circumstances. And I leave that open to that question every time that I make that decision. This issue is something that has affected someone I know personally. So I am very aware of it. The things with alcohol after that we need to remember after bariatric surgery, number one, it's empty calories. You're not getting any nourishment from it. And empty calories in liquids do not give you a sense of satiety. It can lower your resolve to maybe eat things that you would not normally eat if you were thinking clearly. The other thing is, alcohol is going to affect you completely different because of your altered GI tract. I know for myself, I said that I rarely drink more than one. It's because after one, I've got a little buzz and I don't feel safe drinking a second. So keep all that in mind when you make your choices. Make good choices, think them through, and do your research and ask for help if you need it. If you have any questions or any thoughts, please comment below. I hope everybody has a great week. I cannot wait to see you next week. I am having plastic surgery, a tummy tuck and an arm lift on March 4th, and I'm in the process of doing some pre-op videos about that. So be on the lookout for that. I can't wait to have you all go along with me on my journey. We will see you next time. Bye.